Well, my name is Jerry Pletica. I am a nurse and I own an in-home non-medical agency called Touching Hearts at Home. We're a local provider here in the community and we help people stay in their home or even in facilities sometimes, making sure that they're safe and healthy. Affective disorder, or SAD, like some people like to call it, and that is a type of depression that's related to changes in the seasons. So as we have these lovely bright days, we can also see how cool it's getting, how quickly and how cool it's getting. And that can be a little disconcerting sometimes. But it can kind of begin at this time of year and potentially go through the rest of spring next year. And some people get even seasonal affective disorder even in the summertime when it's so bright. So it's really interesting. It depends on everybody's just a little bit different. Their whole physiological makeup is different. So everyone's just a little bit different. Most of the time, light helps with those seasonal affective disorder kinds of things, those sad type depressive symptoms, but sometimes not. But these are things that we'll talk about what seasonal affective disorder is, and then we'll talk about ways you can help it, okay? So some symptoms are feeling listless or sad, down most of the day, nearly every day, losing interest in activities you once enjoyed. I know that Legends does a fabulous job at lots of activities. If you used to enjoy them and then now all of a sudden you don't, that could be kind of a sign and symptom of seasonal affective disorder. Having low energy, feeling more sluggish than you normally do, hardly not wanting to get out of bed, having problems sleeping a lot or not very much at all, where your sleep is disrupted at night, where you can't get more than 2 hours of sleep at night. Experiencing lots of carbohydrate cravings, overeating or weight gain, anything like that can be a sign. These are generalized things. They could be anything really, but under seasonal affective disorder, it could be something to consider. Having difficulty concentrating, if you like puzzles, if you like other kinds of activities that you just can't seem to focus on, that's a possibility as well. Feeling hopeless or worthless, guilty for not feeling up to what you normally do, that can be a sign as well. And then having thoughts of not wanting to live or just being absent. I was actually, previous to this, I was listening to someone talking about not suicidal thoughts per se, but just not wanting to be here anymore. And I really appreciated that because there are times in all of our lives that stresses come up so vividly that we wish we weren't here to deal with them, you know? But unfortunately, or fortunately, whichever way you want to look at it, the struggles that we have in our life make us better people and better to be around. If we're just think that, you know, everything's happy-go-lucky all the time, we often aren't very pleasant to be around. So those that do have bipolar or any other psychological issues do struggle sometimes with seasonal affective disorder a little bit more. And sometimes they can go from really depressed to really like overwhelmingly anxious and can't sit still or sit down. So those with other psychological issues in addition to seasonal affective disorder can increase those symptoms as well. They call that mania when someone is overly anxious. So when do you need to see a doctor? It's normal to have some down days. It's not uncommon, especially as it gets darker, not uncommon at all. I highly recommend, you know, talk to your friends here. Talk to even the staff if you feel led, or the nurse might be a good help. But if you feel down for an excessive amount of time, you just can't seem to shake it, that might be a good time to see a doctor. This is especially important if your sleep patterns are disrupted, if you go to higher pain medications, if you have a pain medication prescription and you take more than normal and it just seems to be daily that you continually do that, or every day you can't make it without having a drink of alcohol or something like that, that might be a sign that you might need to see the doctor. And again, if you feel hopeless or suicidal or just don't want to be here, those are always good times to talk to your doctor. So some causes of seasonal affective disorder, your biological clock, the reduced light, sunlight in fall and winter may cause winter onset seasonal affective disorder. It can really mess up your internal clock. So we'll talk about fixes here in just a bit, but that could be why it's happening. Serotonin levels, that's a different hormone that keeps you regulated both in being awake and being asleep, and the right time to be awake and the right time to be asleep. Serotonin's a brain chemical, it's a neurotransmitter, and there's other hormones in your body that help you sleep and be awake at the appropriate times that affect your mood. Reduced sunlight can cause a drop in the serotonin and trigger depression. So there could be some SSRIs or antidepressants that could be helpful, or there may be a natural remedy if you're not really interested in antidepressants or anti-anxiety type medications. Ask your physician or your provider about some alternatives. What can you do? I know there's some natural things. One's called valerian, and that can be very helpful for those that can't sleep at night. Melatonin may be a good one too, which is the very next thing. Melatonin levels change during the season of getting darker earlier and can disrupt the balance of the body's level of melatonin, which plays a role in sleep patterns and mood. So if anybody remembers history or reading about historical events in the past, I recall reading many history books where when the sun went down earlier because it was a natural progression in our hemisphere, people would just go to bed earlier. And then they would stay in bed later, and then they would get up later and then just do their daily chores during daylight. With the advent of lights, we're then expected to do all this in a bag of chips and do all the things that we're normally have always done, but it's like we are running on empty because cyclically in our life, our nature hasn't changed. So if we wake up with the sun and go to sleep when the sun goes down, really physically, we're doing very well. If we fight that with the lights and expectations of ourselves and things like that, that can play on our brain a little bit. So keep that in mind too. Cyclically and in nature, we're just really supposed to sleep when the sun is down. When the sun is up, we're supposed to be awake. Talking about the SAD lights, has anybody heard of those? Or these really, really bright lights? They're called SAD lights, and I would recommend them, especially for those of you that are unable to get outside in the wintertime due to being too cold or just not feeling up to going outside. SAD lights that are a specific lumen, they're not incandescent, they're a particular lumen. I don't remember the exact percentage. I want to say they're 4,500, so they're super bright. And you put them somewhere in the vicinity of your eyes for 10 to 30 minutes a day. And it can help. And sometimes it's morning and night, or sometimes it's just one time a day. I want to say, I lived in Seattle for 28 years and I had one, but I really didn't use it too much. I don't know what happened because it's much darker in Seattle. And then when I moved here 6 years ago, I used it for one season because I was working on the computer all the time. So not only was it dark, I was looking at a computer for many hours a day. And so for a season of, a month or two, 3 or 4 times a day for 20 minutes, I would get that light to where it was penetrating my eyes. And that seemed to really help my mood. They say even now, if you can get up within the first hour or two of sunrise and you get that sunlight in your eyes for just a couple minutes, don't stare at the sun, but look off to the side, but have the sunlight really beaming into your eye, that can be very beneficial for overall health. So if you want to just do a really easy thing, that's a really easy thing because you have a sun, not every day. We had rain the other day, so we're not going to have sun every day. But when you have an opportunity to be outside and have the sun come into your eyes at some point, again, don't look at the sun, look off to the side, but have the sun kind of coming into your eyes. So some risk factors of SAD, some family history. If people have blood relatives that have struggled with depression or SAD in the past, they may be at more risk for having depression. Again, talking about other psychological issues, bipolar, depression can be increased potentially. Obviously, living far from the equator. I mean, we don't live in Alaska, thankfully, where they have sunlight, I don't know, 4 hours in the wintertime. I've never been there, but I can't even imagine. There was this movie back in the 90s, and it was a murder mystery. And it was right at the time where the sun was going like 18 hours a day. It was so eerie, just the light going that much time. So that makes me think, wow, there's some people that might have some SAD up there. And then lower levels of vitamin D, especially in our northern hemisphere, can really play havoc. Everyone I have heard in the northern hemisphere where we live, everybody should be taking vitamin D. Now, I can't tell you how much. Your provider needs to tell you that, but everyone should be taking that, and that can be helpful for overall health. It is a fat-soluble vitamin, so it does stay in your system for a while, but if you don't take it and we're not getting enough sun and the rays from the sun penetrating your skin for a certain amount of time every day, you're just not getting enough vitamin D. Complications with SAD is social withdrawal. So, pay attention to your friends here. If you live here or are in the community, if you notice you're withdrawing, come up or have a friend come up to you and say, hey, I notice you're withdrawing. Let's have a conversation. What's going on? School or work problems may increase. Again, substance abuse, we talked about that. Other mental health disorders such as anxiety or eating disorders, eating too much. Prevention, which we will talk about with our list. All right, so we've already talked about one way to help you in this season of seasonal affective disorder. Talk to your doctor. Now, this is in no particular order. It's just the number one that I found. I had many more than 10, but I'm just going to talk about 10, okay? If your doctor has no idea what seasonal affective disorder is, or a sad light, or melatonin, or lights in the eyes, that's okay. They aren't taught that kind of stuff. These are things that I've learned over my course of my life, because these are things I needed when I lived in Seattle and then earlier when I lived here. So don't fault them for that. Just say, these are some things I've been thinking about, and they might say that's a good idea. Right now, this class is preparing your mind for the darker days. So this is a really good thing to just have this conversation. Now that we've had this conversation, that there are 10 things you can do or more, then you can have a conversation during your dinner time, your conversations with your family. This just gives you a stepping stone to be able to talk about it, because a lot of times we, in our society specifically, we don't like to talk about our problems. We don't like to talk about our depression. We don't like to talk about that stuff. Well, the one thing you can do is say, I'm really struggling with seasonal affective disorder, which I just learned about. But the proactive thing I am doing is aromatherapy, which is number 5. So it's not that we don't want to hear about it. We just want to know the proactive things you're doing to help yourself, which is sometimes people get stuck in there complaining, and that's when people kind of turn things off. So we want to talk about these things. We definitely do, but we want to take proactive steps to help you during this next season, which will be a little bit darker and gloomier. So preparing your mind is talking about it, what you learned today, and we'll do a question and answer after we're done and kind of quiz you and see what your takeaways are.